Welcome to Hiranya Medical Service. 5 minutes to a better health by our eminent doctors.
Hi everyone, I am Dr. Sujata Gajendran, Senior Consultant Obstetrician and Gynecologist, practicing at my own clinic, Wellness Women Clinic at Mogapay. And I also practice in several other corporate hospitals in Chennai, like MGM Healthcare, SIMS Vadapalani, Apollo Health Center, and, uh, and small hospitals. I take this opportunity to thank Hiranya Medical Services for their excellent gesture of taking healthcare to doorstep through this online platform, through this medical series. Today's topic is hypertension in pregnancy. What are the take home tips which a pregnant mother should know to avoid complications if she gets it, and what are the ways to prevent it so that it will be easy for them to follow? I'll share my screen. So, hypertension in pregnancy. When the blood pressure is more than normal, that is 120 by 80 mm of mercury, in the second half of the pregnancy, that is more than 20 weeks, we call it as gestational hypertension, or any pregnancy where the hypertension is detected way ahead, that is in early pregnancy itself, it is known as hypertension complicating pregnancy. Why is it risky? Who are the candidates who are at risk for this condition? What are the effects on the pregnant mom and the baby? What are the symptoms which the pregnant mother can present to the obstetrician? And what are the treatment modalities and how to prevent it? So, why is it risky? Because it affects the natural growth of the baby. That is, the blood flow to the baby is compromised due to this medical condition. It affects the pregnant mother health in a very bad way, and it can result in several complications to the mother. And the pregnant mother is at a risk for delivering before 37 completed weeks, which we call it as term pregnancy. So any pregnancy which ends before 37 weeks, we call it as preterm labor. And if you don't control this hypertension in the pregnant mother, it's a very fatal outcome for the mother and the baby also. And who are the candidates for at risk for this gestational hypertension? That is primigravida, the pregnancy for the first time, whose age is less than 20 years or more than 40 years. The mother whose BMI is overweight or in the obese category. There is a previous history of preeclampsia wherein she had resulted in preterm labor, loss of baby, or she has thrown a fits. All those candidates are at high risk of developing hypertension in this pregnancy also. More than one baby in the womb, that is multiple gestation, mother having hypothyroidism in pregnancy, and who have conceived with ART. What are the effects on the pregnant mom and the baby? There is a sudden increase in the weight, that is more than half kg increase in the pregnancy at every week. There will be swelling of legs and face. You can tell them that if there is any tightening of the rings which they wear or the bangles. These are small things which you can identify when they are complaining of this problem. And they might have some imminent signs like headache, visual disturbance, and a pain in the upper abdomen. These are the imminent signs that the mother is deteriorating and she can throw a fits. And the lab parameters gets altered, that is the platelet value, that is blood clotting, that cells decreases. There is a change in the liver function test, and the mother can have protein in the urine above normal. And the growth of the baby is also compromised, and she can go in for a preterm labor pains. What are the treatment modalities? That is, first and foremost thing is the mother should have a proper regular antenatal checkup at the prescribed time. That should have a regular BP monitoring, and if at all identified when required, she has to be treated with drugs. We have to follow up with the labs regularly as the doctor advises to find out if she is worsening in her condition, and the growth of the baby should be monitored by doing an ultrasound to see if the placental flow and the blood flow to the baby is proper. And what are the preventive measures? That is, the female who are planning for pregnancy or who are getting married, the BMI should be within normal limits. They have to take proper prenatal vitamins, avoid excess salt, do regular exercise, and have enough rest, that is sleep. By doing all this, we can prevent this condition to a very great extent and decrease in the incidence of gestational hypertension. Hope this video was useful, and thank you once again.
Thanks for watching. Do like, share, subscribe and click the bell icon button to receive instant updates.